Our purpose in this presentation is twofold. First, to shed light on some ethical and policy issues emerging in science and science communication in times of crisis. And second, to explain what distinguishes a reasonable disagreement that may arise in the context of properly functioning science from misinformation or dissemination of false news. Following Elliott, we first discuss two different problems related to science communication. How should we talk about it, and what should we say? We argue that the COVID-19 crisis as a case of health emergency affects the weight of both these problems. And then we turn to the debate between Ioannidis and Taleb with the aim to reconstruct the arguments provided by the two scientists and then figure out the features of a reasonable scientific disagreement. So it was in February 2020 when the WHO's Director General, Tedros Adhanom Ghebreyesus, said that we are not just fighting a pandemic, we are fighting an infodemic, that is an overabundance of information about the novel coronavirus and the disease it causes, which is often false or misleading. Science communication plays a key role in this fight. However, the attempt to counter coronavirus misinformation by providing access to more accurate information is prevented by the uncertainties surrounding this pandemic. We are facing an extremely wicked problem, which means that there is no definite formulation or explanation of it. And so the need to properly inform the public about COVID-19 gives rise to the following two questions. How should we talk about it? What language should we use for the transmission of scientific information? And what should we say? The first question is related to the argumentative practices and patterns used in science communication, and in a certain sense to the problem of thick concepts and metaphors used in this context. The language of COVID-19 communication involves definitions and classifications based on current epidemiological data and subject to constant changes and updates, but it is not merely descriptive. Any reference to public health emergency or pandemic is legitimized on the basis of evaluative judgments. To give but one example, the WHO's pandemic declaration was meant to send a powerful signal to countries that urgent action was essential to combat the spread of the disease. So it was intended to raise awareness, but it could also instill panic and fear in people, and that was why the appropriateness of this declaration, as well as of the time at which it was made, has been subjected to considerable criticism. Besides, scientists can use informal argumentative practices or means of persuasion. While communicating with the public, they often rely on metaphors for scientific explanations or abstract scientific concepts. But despite their utility, all these practices or means of persuasion can also constrain reasoning, as we shall see. The second question has to do with the risk of error involved in decision-making under uncertainty, the so-called inductive risk. Depending on the range of these decisions, we can distinguish different versions of this problem. The assumption is always that there is a gap between data and hypothesis, which allows non-epistemic values to enter scientific reasoning. But while in a traditional version of this problem, the risk is limited to the final decision that the scientist must make on whether or not to accept a hypothesis, the decision that is that the evidence is sufficiently strong to warrant the acceptance of a hypothesis. According to a more recent version that we owe to Heather Douglas, the risk is present from the beginning and throughout all scientific process. So even a purely methodological decision, such as the choice of a level of statistical significance, involves values according to this argument, that is an appropriate balance between the two kinds of error, false positives, false negatives, and therefore a decision on which errors we should mostly avoid. In cases of public health emergencies such as the coronavirus pandemic, where the research is conducted under time pressure and the need to move expeditiously is of vital importance, we also need to find an appropriate balance between the need to act and the desire for more reliable findings, which would nevertheless be time-consuming. So the question that arises here is which of the research results could responsibly be communicated to the general public when these results are controversial. They are revised or updated almost daily. They are often inaccurate or conflicting, and they furthermore lead to non-accountable and or irresponsible decisions in the sense that the responsibility for these decisions can be transferred from the political level to healthcare workers and vice versa. A concern expressed here is that the presence of scientific discourse in the public sphere may create confusion and distrust in both science and government, or undermine the consistency of the message if people see research data and recommendations being constantly revised or scientists failing to reach an agreement on them. But it is also argued that precisely because the scientific basis for decision making is indeterminate and scientific controversies may reflect ideological or political differences, all the relevant information should be made publicly available in terms of full transparency and with the aim to involve in decision making those affected by or interested in these decisions. The recent debate between Ioannidis and Taleb on COVID-19 forecasts was quite revealing of the interplay of science and values in assessing and regulating different types of risks under uncertainty. It started from the question of whether forecasting for COVID-19 failed, but it actually focused on the need to take or refrain from taking any strict but costly measures to prevent and control the spread of the disease, which is a rather political issue. The assumption underlying this initiative was that there is a strong connection between forecast evaluations and the particular view one holds about how to handle with the pandemic. But one of the most important lessons we should probably draw from this debate was that this assumption was quite vulnerable. The question at issue for Ioannidis and Taleb is not whether forecasting for COVID-19 failed. There is no doubt or controversy over forecasting failure or the uncertainty inherent in clinical and epidemiological research. But because of this uncertainty, Ioannidis argues that we may be overestimating the mortality risk of COVID-19, which means that more reliable data are needed to proceed to show strong prevention and protection measures, while Taleb believes that the magnitude of the risk we run if the pandemic's worst case scenario comes true makes it imperative to take immediate action. So here is the structure of the debate. Let's call P the contested issue, how to handle the risk involved in the assessment of high mortality rate. Ioannidis looks for more and better quality data to narrow down the risk before restrictive measures are taken, whereas Taleb takes the risk to be high enough to warrant an immediate curbing action plan. A purely scientific disagreement lies here in the interpretation of fat tail distribution and the importance of focusing on the extreme values of a distribution for the validity of forecasting on the one hand and the management of foreseeable risks on the other. Taleb argues that a global disease outbreak is an extreme but highly consequential event. That is an event that falls on the tail ends of a statistical distribution. It's not very likely to happen, and nevertheless represents a source of existential risk. So all relevant information lies in the tails themselves, and therefore risk management decisions should be based on them. For Taleb, while Ioannidis sees selection bias in choosing tail events and argues that the focus should be on the entire predictive distribution. It is obvious now that if we focus on the extremes, as Taleb suggests, we will probably overestimate the risk. We will assume that this risk is higher than it actually is, or what at least the mean of the distribution suggests. We will probably underestimate the risk if we focus on the entire distribution of forecasts on the other hand, as Ioannidis suggests. In any case, risk assessment varies depending on where the emphasis is put. However, the opposite might also be true. It might be that the assessment and relative weighting of foreseen risks determines where the emphasis should be put, in which case we are talking about a non-epistemic decision, that is a decision that cannot but and or should involve human values. It's not clear here which of the two applies, and the argumentative practices at which the two scientists resort create even greater confusion. There is a whole section in Taleb's paper entitled Fortune Cookie Evidentiary Methods, for example, to stress the failure of evidentiary methods to work under both risk management and fat tails. So it is supposed to strengthen Taleb's argument, but it could also reinforce public mistrust of science. Ioannidis, on the other hand, accuses and rightly Taleb of having misrepresented his positions, but he changes in turn the subject of discussion when he notes the progress made in science since the times of the Antonine Plague or even 1890. The question for Taleb is not whether the science we have is capable of identifying the pathogen or elucidating its true prevalence, but the time we should spend on it. He is more concerned with the consequences of delayed response, while Ioannidis argues for evidence-based responses. So we see in both cases a kind of ignoratio elenchi, that is a distortion of or departure from the issue in question, which creates a great deal of confusion regarding both the depth and extent of the disagreement. And similarly, with the use of analogies, both Ioannidis and Taleb make use of this strategy to support their claims. However, the appropriateness of these analogies is judged on the basis of prior risk assessments. When, for example, Taleb compares the precautionary measures we should take for COVID-19 to the need of wearing seatbelts in car, Ioannidis says that seatbelts cost next to nothing to produce in cars and have unquestionable benefits, and he compares instead seatbelt use with the use of masks. So it is obvious that the two scientists do not focus on the same problem, or they assess both the prevailing circumstances and the levels and kinds of risks we can accept or tolerate under the threat of a pandemic differently. Ioannidis is more concerned about the financial consequences of a prolonged lockdown, while Taleb focuses on the health risks of the pandemic. And yet, this is a reasonable scientific disagreement that can arise in the decision-making process under uncertainty, as we argue here, whereby scientific, we mean that this is a disagreement arising in the context of science or scientific enterprise as a practice which largely involves evidence-based reasoning and complies with certain norms or standards and rules of inference, while by reasonable, we mean that this is a disagreement about P such that each side holds mutually inconsistent or simply different views about P without, however, flouting any criteria of rationality, for example, taking all relevant evidence into account, being responsive to reasons and argument, open to criticism, etc. So what is required for there being reasonable disagreement about P? Either there is no fact of the matter about P, for example, P is about an issue of taste or aesthetics, or there is a fact of the matter about P, hence the disagreement is potentially factual, but there are value-related issues here, such as the criterion of relevance or the level of acceptable risk, etc. These issues are such that there are no context-independent ways to address them. There is no value-free framework in which they can be set, but such a disagreement does not affect or challenge the validity of science as such, and it can furthermore be settled and minimized or resolved in light of new evidence. The disagreement now between Ioannidis and Taleb is a reasonable scientific disagreement, as we say, since confidence in both science and scientists prevails, or is at least positively related to the conduct of the debate and the willingness of the two scientists to participate. The papers are subjected to peer review. Throughout this process, both the validity and strength of authors' reasoning, the methodology of research, as well as the evidence provided in favor of a fact, are independently assessed and approved. The use of certain standards and procedures or inference methods is required. Both the protagonists of the debate and the anonymous reviewers commit themselves to some normative principles or conventions which fill a large part of the gap between evidence and scientific hypotheses. They are supposed to guide and or restrict scientists in their decisions and coordinate them. They help them cooperate with each other. The context of the discussion is clearly defined. There is a well formulated and defined problem, while conventions determine also to a large extent, though not absolutely, when or whether a problem solving or management process or solution is effective or appropriate. The uncertainty is not anymore radical. It can be modeled or described through probabilistic reasoning. The risk of error is reduced with further data collection and probability redistribution. But it is a reasonable disagreement too, since there are no definitive answers or universally accepted and applicable solutions. Scientific beliefs are subject to constant revision, and yet the urgency of the situation warrants immediate action. The risk of COVID-19 transmission requires acting in a situation of undesirable uncertainty, where policy decision-making reflects value trade-offs. Scientists need to judge and balance risks and expected benefits or costs if they are to engage in devising policy responses, and here non-epistemic values become a lot more visible. That is, more or less conscious ethical, economic, political, or personal interests and values which may normally differ from scientist to scientist and result in conflict. The variety of the values involved creates a substantial heterogeneity in risk assessments, and policy responses vary accordingly. But as research continues and constantly new data come to light, the extent of the disagreement changes too. Scientists revise their explanations and models, and they are forced, in some sense, to do so, for they submit them to the judgment of their colleagues. So it should be made clear that the key hallmark of science is not the absence of human values or much more the stability of its results, but the fact instead that scientists should substantiate the claims they make, submit them to peer review, and in any case revise them. Scientific recommendations and suggestions should be recognized as being transient, but equally important is to recognize that scientists often disagree. Even when they have access to the same data and comply with established rules, scientists may hold different beliefs regarding data characterization and interpretation, or on what counts as relevant evidence. But this is a normal mode of communication within science and an arguably indispensable condition of its progress. That being said, there is a need to appropriately assess the legitimacy of the values involved in decision making in terms of transparency, accountability, and public participation. The public should be kept informed of the risks and potential interests involved in decision making. The principle of accountability requires compliance with the applicable scientific standards. Scientists are first and foremost accountable to their colleagues in the sense that they are expected to provide reasons for the decisions they make, given the collaborative nature of science and the distribution of epistemic agency. But policy issues cannot be solved by scientific evidence alone and in accordance with established standards, and so those responsible for devising science policy should be accountable to the public too for the decisions they make. And finally, people should be involved in the decision-making process, especially if they are likely to be affected by these decisions. It is a matter of justice and a way to restore at the same time public trust in science, given the increasing suspicion towards scientific findings. But for this to happen, it is vital that the public be informed and critically engaged in policy decision-making, and scientists in turn become more receptive to public feedback. Science communication can play a key role in this direction, mediating the relationship between scientists and the public. It could make public views heard, thus increasing public integration in decision making, but it also should and can help to uncover the non-epistemic values influencing scientists in their judgments, and independently of their depth or causes, scientific disagreements are arguably essential to this end. So to return to the question we saw above regarding which of the research results should be communicated to the public when evidence is inconclusive or scientists disagree. We say that there is neither way nor any legitimate reason to hide the uncertainty of science or the values involved in decision making. It is unrealistic, as Elliott and Resnick have convincingly argued, to think that scientists can provide policy advice without being influenced by their personal interests and values, and it is imprudent too to insist or pretend otherwise. We would say when most of these decisions are often proved wrong and revised. And so the question is not whether or not to communicate uncertainty or which results should be communicated to the public, but how to communicate them so as to help the public understand the nature of value-laden decisions that scientists need to make. The public should be made aware of these influences and perhaps a public debate between scientists holding opposing views, like the one we presented today here, is one of the most effective ways to this end. Thank you very much.